Picture this: a world where medical consultations are reduced to ticking boxes on pre-printed assessment sheets. Now let's pause and ponder. What does this mean for healthcare? As far back as 1996, the National Health Service, known as NHS in the UK, began using pre-printed assessment sheet, claiming it is in the interest of medical profession. Doctors voicing concerns regarding the use of these forms were harassed, humiliated, and victimized. But why? Taking a patient's history isn't merely a mechanical process. It is an art form. Doctors spend their entire life to master the skill. It forms the bedrock of medical education. It is the tool through which doctors glean a deeper understanding of their patients, an understanding that transcends mere symptoms. But the picture changes with pre-printed assessments. They're not just forms in the computer. They're symbols of a shift in medical practice, a shift that may not always be for the better. Symptoms and signs are not like A to Z used to find your way when you travel. We wrote Algorithm and created PAT in 1985. This was the first program to help reduce hospital admission, and no, we cannot use AI to help doctors or patients use ChatGPT or Gemini. Every person who seeks medical attention is telling a story of an illness as they have lived, experienced, and remember it. And so it always varies. The duty of a doctor is to listen, offer a solution, and not a prescription. Consider this: young doctors, fresh in their careers, relying more on these forms than on their ability to think critically. This reliance could potentially lead to diagnostic and treatment delays, especially in emergency situations. This is unethical because the duty of a doctor is to make the right diagnosis early to prevent devastating complication or death. Now, imagine a patient already in a vulnerable state, feeling even more overlooked as the doctor's attention veers towards filling the forms in the computer, with no eye contact, making the patient feel uncomfortable and lose trust. This is where the role of the experienced doctor becomes paramount. They need to mentor their junior counterparts, to teach them the art of history-taking, identify errors, and rectify it to ensure the human connection is not lost to a sheet of paper. Because who are these junior doctors? They are the leaders of tomorrow. They are the future of healthcare. We must equip them with skills that go beyond checkboxes, protocols, guidelines, and forms. Because at the end of the day, healthcare isn't just about treating diseases, it's about understanding people. It's about preserving the very essence of medical care. Preserving patient-doctor relationships. Because in healthcare, patients are more than just symptoms and signs. If the pre-printed questionnaires, the tests, scans, and the so-called evidence-based medicine was 100% accurate, we would have created software and stopped nurse triaging to protect humanity. Please scan QR code to get free ebook, Maya Fighting Infections, Saving Lives. Empower yourself to make informed decision to protect your family, friends, and your own life. Please like, comment, and share the link. Thank you.